IVF and ICSI, should it be used for male factor couples only? The day of the egg retrieval, the major eggs that we obtain can be fertilized by conventional IVF or by the ICSI technique. Conventional IVF consists of combining sperm with eggs in the laboratory. ICSI or microinjection consists of the embryologist selecting a single sperm and with a fine glass needle and injecting it into the egg. Differences in the rates of fertilization depend on egg and sperm quality, and at present, embryologists usually prefer the ICSI technique to conventional IVF. There are some strict indications when ICSI should always be performed. These are mainly due to an abnormal variation in the sperm, like oligo, asteno, teratospermia, or combination of all of them. In these cases, there is no doubt that ICSI should be performed because altered sperm quality influences the fertilization potential of the sperm cells. In several cases, an extra technique for sperm selection may be indicated before proceeding to ICSI, such as fertile chip. Another indication for ICSI is when the sperm is obtained by testicular aspiration or biopsy, or in the case where frozen sperm is to be used after the sperm has been cryopreserved before chemotherapy or an important operation. When using high-valued sperm, we don't want to take the risk of a possible fertilization failure. But what happens if the sperm quality is good? If there is a normal ovarian reserve, no formal treatments have been performed that indicate a future fertilization problem, or the couple wishes to use only conventional IVF, we can use this technique. The advantage of conventional IVF is that it's easier and also cheaper to perform, and fertilization takes place in a slightly more natural way. In patients who have a limited ovarian reserve or high-valued eggs, for example in egg donation treatment, we always recommend ICSI. If the patients decide to do preimplantation genetic diagnosis of their embryos, now called PGTA, we would also recommend ICSI. The same is true for cases when the eggs had been frozen before and are thawed for the treatment cycle. Lastly, we always recommend ICSI instead of conventional IVF if we suspect previous fertilization failure, for example after several treatments with artificial insemination or after sterility of unknown origin. Summarizing, the clearest indication for ICSI is a diagnosed male factor. The other indications are when there is a risk of fertilization failure or if we want to guarantee the highest fertilization rates. In the clinical practice, almost all couples use ICSI technique and only few of them use conventional IVF or a combination of conventional IVF and ICSI.